Malawi is in the grips of a food crisis, the worst in a decade. It follows flooding and a prolonged drought. Now, some 2.8 million Malawians are in need of urgent food aid. To assess the scale of the damage, the United Nations Children's Fund is carrying out mass screening for malnutrition across 90% of the country. It's a mammoth task and involves travelling to remote communities who might not otherwise have access to life-saving care.
We're at one of the rural outreach centres. People living in the area were told to come here and find out if their children are suffering from malnutrition. From here, they can get access to treatment. And as you can see, there's been a pretty big turnout.
The community has been facing moments of acute food shortage and a lot of challenges in terms of livelihoods, food insecurity, diseases. Those ones are common here. We expect to screen up to 115,000 children in the entire district. So part of this drive is basically to reach the children from the very setting where they are, so that we increase the number of those that are getting referred to the health centres in order to get care.
Annalise Roberts' 2-year-old child has just been diagnosed as malnourished.
I came here to get help for my little girl. There's a food shortage, but I don't even have enough money to buy any. I need to get her help because she hasn't been eating enough.
Malnutrition also affects the immune system of the person. It is lowered because of the malnutrition, and then the person is prone to a number of diseases, like diarrhea, for example. Talk of any infection that would be more severe to someone who is malnourished as compared to someone who is well nourished. So it can even lead to death.
Malnutrition also impacts severely on the development of the country as a whole. A report last year by Malawi's Finance Ministry, the World Food Programme and the African Union Commission says inadequate nourishment in early life affects 60% of Malawians and costs the economy millions of dollars a year. With 2/3 of the population working in manual activities, it decimates the country's potential workforce. Malawi is estimated to have lost over $66 million in 2012 alone because of the reduced productivity of those who were stunted as children. The worst may not be over. UNICEF has warned that as the lean season reaches its peak between February and April, the number of those suffering from malnutrition is likely to rise. Clementine Logan, CCTV, Zomba, Malawi.